The opioid crisis has devastated our region and communities around the country.
While we're still dealing with it today, tonight we're taking a look back at how it all started. WECT's investigative reporter Emily Featherston joins us now. So Emily, you looked at some data. Specifically, what did you find?
Well, John, oxycodone and hydrocodone, those two drugs made up more than 3/4 of the prescription painkillers shipped to pharmacies in the late 2000s. And we now know that they fueled an epidemic.
It's hit so many levels of the population in so many different places.
A tidal wave of pills.
We couldn't figure it out. It was so bizarre when it first started because it was just different from anything we'd ever seen before.
An epidemic with a powerful foothold.
At this point, I was in such a deep hole that in my mind, I was like, there's no getting out of this. So I give up. I'm not done. I'm going to go until the wheels fall off.
And deadly consequences.
64,000 people in this country last year. More than the entire Vietnam War. 1 year, 64,000 people died from opioid overdoses.
The opioid crisis reached a fever pitch in 2016 and 2017. Overdoses on heroin and then fentanyl had steadily climbed for a decade. Then came the Castlight Health Study, which ranked Wilmington as leading the nation in opioid abuse. That narrative caught on, with politicians and law enforcement referring to the Cape Fear region as ground zero. And while the study was limited by a small sample size, it was still a wake-up call for many, leading to a push for stronger laws and access to treatment. But while studies highlighted the devastation in communities across the nation, many were left wondering why and how things had gotten so dire.
People are looking for who to blame, I know, and there's lots of blame to pass around in this crisis.
Now, thanks to a successful legal battle by the Washington Post and Charleston Gazette-Mail in West Virginia against the Drug Enforcement Administration, we know more about the tens of millions of pills that poured into our area from 2006 to 2012, year after year after year. 66 million in New Hanover County, 44 million in Columbus County, 43 million in Brunswick County, almost 14 million in Bladen County, and 9 million in Pender County. More than 177.6 million pills across just 5 counties. Put another way, if you look at just Columbus County, 113 pills for every man, woman, and child were dispensed per year.
It just got crazy where, I guess, people had built up tolerance to the drugs. They became addicted to them.
At her pharmacy in Hampstead, Beth Cavaniss says, among other strange behavior, she would see people from West Virginia trying to fill prescriptions from Florida doctors. Those at recovery centers say, in hindsight, they see distinct patterns.
What was happening during that time period is people who had been, for example, prescribed opioids in various settings had become dependent on those medications. Those medications were not really meant for long-term use anyway in their original design. And then that they were transitioning from being dependent on the prescription opioids to using what we more refer to as the street drugs, or drugs like heroin. So we saw that shift starting to take place.
Former Wilmington resident Brent Botros experienced that shift firsthand.
Like, my hierarchy of needs in my brain was shifted around to where drugs, alcohol were at the very top, before sleep, before eating, before anything else. So that was completely shifted around. I needed that just to function normal.
He says he got addicted to opioid painkillers after stealing them from his mom's medicine cabinet when he was about 15. By the time he turned 21, he was using heroin.
Once I felt that rush, I knew that this was going to be cheaper. This was going to give me more or a better high. And it was also going to help me to feel better too. So I began using that consistently, just about every day. Sometimes sometimes 2-3 times a day.
After a dark journey, Botros made it to a California recovery program, which he now works for. And his story is a familiar one to many in the Cape Fear region and beyond.
Somewhere around 80% of people with their non-medical use of these very powerful and addictive painkillers, that they really didn't get it from the sources we thought they were getting it from. We thought people were getting that from drug dealers. We thought they were getting these drugs from the internet. You know, we thought it was just limited to people who were doctor shoppers. We found out that that only made a small percentage, that over 80% were getting it from a family member, a friend, or their primary care physician, not even from an emergency room, from a primary care physician.
So who is responsible? State and local governments, including New Hanover County, have taken pharmaceutical companies to court over their role in how drugs like oxycodone and hydrocodone were marketed. Those go to trial in the coming weeks. And doctors are now bound by the STOP Act, which puts strict prescribing limits in place. And pharmacists are tasked with scrutinizing every single transaction. But many worry it just isn't enough.
A WECT Investigates series on the opioid crisis continues. Last week, we covered the origins of the epidemic, but you might have noticed, as we did, the topic has fallen out of the headlines as time has passed. We and others have heard some people think this means the issue is fixed and we can move on. But tonight, WECT investigative reporter Emily Featherston is here with a report that shows we still have a lot of work to do. So, Emily, where are we with the opioid epidemic?
Well, Fran, we have made progress through new laws, recovery centers, and task forces. But just as it took us years to get into this situation, experts say it's going to take years or even decades to get out of it. It's been more than 2 years since a high-profile study named Wilmington as one of the worst spots in the country for opioid abuse. In the time since, new laws have passed to slow down the tens of millions of pills pouring into the region and punish those distributing illicit drugs like heroin or fentanyl.
Some people say, well, we've stopped the overprescribing for the most part, so aren't we in the clear?
By some measures, things are getting better. North Carolina state officials announced a 5% drop in overdose deaths in 2018 compared to a 34% increase in 2017. New Hanover Regional Medical Center says its efforts have curbed prescribing, keeping 836,000 pills from being dispensed. But other experts have doubts. So we pulled all New Hanover County 911 calls related to overdoses from the beginning of 2017 to September of this year. Of the more than 2,600 calls, some were duplicates or canceled, but we found numbers so far in 2018 are on par with last year, with 275 patients transferred for medical treatment, 38 treated on site, and 7 dead on arrival. Wilmington Fire Department has actually seen an increase in overdose-related calls. Through the end of September, they've received 117 calls, compared to 78 during that time last year. Kenny House believes this may be because most efforts have been focused on preventing new cases of addiction, not necessarily addressing those already affected.
More people are walking in every day requesting treatment for opioid dependence than ever before.
Even now.
Even now. And that's been a point of interest because people are wondering, well, haven't we pretty much solved the opioid crisis? Isn't it going down? Is it getting better? From the standpoint of overdoses and from the standpoint of people needing treatment, it's actually slightly increased.
Really?
And the demand for treatment has greatly increased.
House says that doesn't mean we aren't making progress, just that the progress being made isn't with those already addicted to opioids or other substances. And even the efforts that have been made are being questioned, particularly medication-based treatments. Brent Botros, a former Wilmington resident and someone in recovery himself, says he knows all too well the risk that medications designed to help addiction will be abused.
I remember the first time that I was given Suboxone, the first thing that I tried to do was shoot it up. I didn't even, I wanted that rush, and then when I tried it, it worked. It gave me a high, help me feel better.
He says the problem is those treatments don't heal the underlying causes of addiction.
It's not going to heal the person. If you give them a medication and you expect them to recover from all their past traumas, to recondition the way that they think, the way that they operate, and their lifestyles, then that's not going to do anything.
Those on the front lines, pharmacists like Beth Cavanis, say they are starting to see the same patterns with treatment medications that they saw with prescription painkillers.
I feel like I'm starting to get phone calls now where when it was the opioid crisis, people would call and say, you know, do you have the IP312s? Like, what? Do you have IP312s? And what they were doing is they were reading me the imprint on the Percocet that they were interested in getting. And when you do that, that's a red flag to me. Now they're doing that with Suboxone. Do you have the orange ones? Do you have the white ones? Do you have the ones with this imprint? So I'm really I have a new level of concern that the drug that we're supposed to be using to help stop addiction or help get people off of the opiates is now being abused.
So where are we?
I think we are smack in the middle of the crisis. I don't think we're out of it. I don't even think we're almost out of it. But we've come a long way. So we've moved from the onset of the crisis. We've learned some things that are effective prevention efforts. But I think we're still in the middle of this, which means that we need to pay attention to all of that.
Those we talked with say addressing the stigma associated with addiction is something we must do before more progress can be made.
Coverage continues on the opioid crisis with the final installment of our WECT Investigates Addicted series tonight and where we stand now following years of trouble. WECT's Emily Featherstone has been leading this series and joins us with part 3. Emily, you have covered how the epidemic started and the deadly impact it had here. Now you're looking at how to get the community back on track.
Fran, millions of pills would pour into the southeastern North Carolina, and despite some progress, first responders still deal with hundreds of overdose calls each year. So what lies ahead on our road to recovery, and what can we do to better help those still struggling with addiction?
Addiction or a substance use disorder is fundamentally a brain illness. It's treatable, but like many chronic conditions, it's prone to relapse.
In order to beat this thing, you have to fix everything and heal everything that goes on, not just within the person in recovery, but every single person around him.
When you think of recovery, you might imagine a hospital room or an anonymous group meeting. But recovering from the opioid crisis goes far beyond that. Experts say it will take all of us, our elected leaders, law enforcement, healthcare providers, and regular people keeping this issue top of mind. So far, we focused on prescription pills, heroin, and fentanyl because they drove the overdose crisis. But these aren't the only substances we're dealing with.
We can't just focus on opioids because there are other crises happening around the opioid crisis that can be just as dangerous to us coming forward.
House says use of cocaine and abuse of anxiety medication is on the rise. Local law enforcement has seen an increase in meth. But regardless of the substance, addiction is addiction.
We need to pay attention to how we deal with people and look at some of the causes and the root causes of what brings people down the pathway towards addiction.
He says addiction often results from a combination of things people come by naturally, like a genetic predisposition or mental illness, and then their environment, such as childhood trauma, neglect, or PTSD. Having gone through a series of unsuccessful treatment programs himself, Brent Botros says he can say from personal experience that recovery doesn't come with a quick fix.
You have to treat the whole person by helping them to redefine what their lifestyle looks like, adopt new healthy habits, such as exercise, better eating habits, and actually taking care of their bodies and getting the most out of their bodies that they can, you know?
He says it takes a three-dimensional approach, the physical, psychological, and social, and combining those is a lifelong process.
It's not that different from other chronic conditions where sometimes you need a physical therapist to take what the doctor did and told you and put it into action, where you need to learn how to do these exercises, these different things. People in recovery are in some ways similar because addiction is a chronic condition where they need reinforcement, they need good advice, they need to know what we're learning, and then some help in applying what we're learning.
That requires access to treatments that offer that three-dimensional approach. And access is one of the main reasons those struggling with substance use disorders don't seek help. According to a 2018 study, 1 in 3 people struggling with addiction haven't sought help because they don't have health insurance or don't think they can afford it. And 1 in 5 say they wouldn't know where to go even if they did. Beyond that, a third say they are afraid to go because they would be judged by friends, family, or their boss. Getting rid of that stigma, House says, is key to moving us forward.
The more we can get the message out that this is not because you're bad, this is not because you're a failure, this is because this is a brain illness, it's treatable, and the earlier you get treatment, the better. Without judgment about the pathway you need for your recovery or your treatment, I think we'll get a better handle on this crisis and hopefully really see it subside in major ways over the next, hopefully, 3 years.
The opioid epidemic and the greater crisis of addiction surrounding it, they are not simple topics to talk about.
But if we're ever going to make any progress, candid conversations without judgment are critical. That was the message at today's opioid crisis town hall. WECT teamed up with Attorney General Josh Stein's office to host the event at City Hall in Wilmington. We were joined by law enforcement officers, prosecutors, and other officials from around the region, as well as people in the recovery community. While we couldn't get into everything in the 1 hour we had to work with, we were able to start the conversation about where we need to be focusing our efforts. WECT's Emily Featherstone has covered a lot of ground in our WECT Investigates series, Addicted, which you can watch right now on WECT.com. Emily, you were at the town hall today and spoke with some of those in the crowd. How do they feel about the conversation?
Well, really, Fran, those I talked with, those are people who have had addiction personally touch their lives. Many people at today's town hall said that they have. They say that they appreciate the efforts so far and the discussion about preventing addiction and law enforcement, but they think more attention needs to be paid to those who are still struggling right now. Something we heard from several of today's panelists is that addiction is a brain illness, a chronic illness, so it's something that doesn't come with a quick fix. Experts talked about how trauma, like abuse or even genetics, make some people more susceptible to addiction. And they say treatment and recovery isn't one size fits all. The biggest thing, though, that I heard from the experts and just the regular people in the crowd was that these things need to be better understood so we can get rid of the stigma of addiction. Shannon Lloyd, who is from Pender County, got to ask a question at the end. She wanted to know what concrete steps our leaders plan to take and called on everyone to change their views on addiction.
Yes, I understand it's their choice to pick up the first pill, but once they do it and they get addicted to it, I mean, what are you going to do? You know, you're just going to totally discard them? No, because it's somebody's brother, it's somebody's son, it's somebody's daughter, and they need the help, and they need people to stop treating them like they are a piece of crap, because they're not. They are loved, very much loved. And so I want them to do a better job. It's not only going after the drug dealers, it's helping the people that's already addicted.
And Shannon there has lost a son to overdose just last year. And of course, the discussion included so much more than this. If you couldn't make it or watch it live, you can go on our website right now to see the whole thing. And there you can also find the links to that 3-part Addicted series. And this conversation isn't over. If there's another part of the addiction crisis you think we should look into, send an email to investigates@wect.com.